Every year, Medicare gives seniors thousands of dollars in free health care. Most people never use a single dollar of it. Not because they don't need it, not because they're unhealthy, but because no one ever explained how to unlock it. These benefits are already paid for. You earned them. You funded them with decades of work. But Medicare doesn't advertise them. Doctors rarely mention them. And if you don't ask the right way, you never get them. Today, I'm going to show you how to unlock Medicare as preventive care benefits for 2026 and how to stop leaving your health and money on the table. Let's start with the biggest misunderstanding. Most people think Medicare only pays when you're sick. That's wrong. Medicare also pays to keep you from getting sick. That's what preventive care really means. Services designed to catch problems early before they turn into hospital stays, surgeries, and lifelong medications. And in 2026, Medicare covers more preventive care than ever before, but only if you know how to ask. Here's the first surprise. Preventive care is not the same as a doctor visit. When you go to the doctor because something hurts, that's treatment. When you go to the doctor to plan your health, that's prevention. And Medicare treats these two things very differently. If you mix them up, you might get billed for a visit that should have been free. This is where people get frustrated and stop trying. But once you understand the difference, everything changes. Now let me show you the most powerful free benefit in Medicare. It's called the annual wellness visit, and it is not a physical exam. This confuses almost everyone. The annual wellness visit is a planning session, not a test. It's a yearly appointment where your doctor reviews your medical history, your medications, your risk factors, your mental health, your fall risk, and your long-term health goals. Together, you build a personalized prevention plan. And Medicare pays for it 100%. No copay, no deductible, no surprise bill. Only if you ask for it by name. If you say checkup, Medicare may not pay. If you say annual wellness visit, they will. That one sentence matters. Let me pause for a second. If this video is helping you understand benefits you never knew existed, please like this video and subscribe to the channel. This series exists so you don't miss benefits you already paid for, and your support helps us keep it going. And if you've never had an annual wellness visit, comment "I'm scheduling mine" below. Now let's talk about the screenings you might be missing. These are the tests that find problems before symptoms appear. Medicare covers them because they save lives and money. Colon cancer screenings, breast cancer screenings, cervical cancer screenings, heart disease screenings, diabetes screenings, bone density tests. Many of these are free. Some are free once per year, others are free every few years, but here's the catch. If you wait until you feel something is wrong, it's no longer preventive, and Medicare may charge you. This is why proactive scheduling matters. In 2026, Medicare also covers newer, less invasive screening options. At-home tests, simpler imaging, earlier detection tools. Most people never hear about them because no one tells them they exist. But they're in your booklet, they're in your plan, and they're waiting to be used. Now here's something that surprises almost everyone. Medicare covers counseling and support services for free. Nutrition counseling if you're at risk. Smoking cessation programs. Alcohol misuse screenings. Depression screenings. Fall prevention programs. Chronic disease self-management classes. Medicare doesn't just pay to keep you alive, right? It pays to keep you independent. And that matters more than any prescription. This is the relief moment, because preventive care isn't about fear, it's about control. It's about catching problems early, when they're easier, cheaper, and less scary to handle. It's about staying ahead instead of reacting. And Medicare will help you do that if you use it. So here's your simple action plan for 2026. Step 1. Call your doctor and ask for your annual wellness visit. Use those words exactly. Step 2. Ask what preventive screenings you qualify for this year. Step 3. Schedule them now, not later. Step 4. Review your plan every year during open enrollment to make sure your preventive benefits have changed. And Step 5. Keep your Medicare booklet handy. It's not just paperwork, it's a benefits manual. Before the next episode, open your Medicare booklet and find the preventive care section. Highlight the annual wellness. Visit your covered screenings and your counseling benefits. These are the pages that give you your power back. In the next video, we'll talk about something most people never expect until it happens. Medicare penalties. Not just drug penalties. All of them. And how one misstep can quietly cost you for decades. I've linked the official Medicare booklet below so you can follow along. If you want Medicare explained simply without sales, fear, or confusion, subscribe to the channel. Because the biggest Medicare mistake isn't choosing the wrong plan. It's never using the benefits you already earned.